right, we are going to talk about dental terminologies and dental definitions in the hopes of having you become more knowledgeable. So when the dentist, dental provider, healthcare provider, they're talking about these definitions, they're talking about these terminologies, you're knowledgeable and you understand better so you can take more control of your treatment and basically make sure that you get the best out of your encounters with the healthcare professionals. First thing is we are going to talk about abrasion. Abrasion is an injury that results from scraping or wearing away at the tissue in the mouth. This could be caused by injury to the mouth or the use of dental appliances. Usually this happens, actually abrasions, a lot of time happens with using a toothbrush that is too hard and you have to use soft toothbrush. So a lot of people are using these hard toothbrushes and they think they're getting a better job done, but it causes abrasion. It destroys by the gum line. Let's say right here, right by the gum line, when you are brushing really hard, it brushes away the gums. And when the gums are brushed away, it causes a lot of damage to the gums. And then when the gums are brushed away, then next it causes abrasion to the tooth surface itself. Now we are going to talk about abscess. Abscess is a collection of pus, debris that grows in tissues. Abscess is generally pink or red in color, normally presenting with swelling, inflammation, tenderness. An abscess can present for any number of reasons, any part of the body, including the mouth. What's important in the case of abscess is that you get it treated right away, because an abscess that happens on the upper area of the mouth, it can actually go into your in the eye area and from there go into the brain, and it can kill you. And the abscess that is around the roots of the lower teeth, it can go under the airspace underneath, underneath the mandible right here. And when that infection goes there, it goes in airspace, as called airspace 3, and squeezes your throat and ultimately can kill you overnight. Another way of these abscesses, they can be very dangerous. It can get into your blood system, and by the time you get antibiotics and all that, it's too late and it kills you. So please take dental abscesses very serious. The next letter in the alphabet for us is abutment. I know it sounds kind of funny. Abutment is like when you have a bridge and you have a crown prep basically, and there is one tooth that's prepped here, another tooth that's prepped here, and you use these two parts as the posts of the bridge, and the bridge goes on top of that. Those two posts that are holding the bridge, those are called abutments. In the case of an implant is actually like an abutment. Basically, there's the implant screw, and the part that goes on top of the implant, that little part right there that connects to the crown, that is called an abutment. The next definition that we like to talk about is etching. Acid etching is a process of using acid chemicals, substance to strip the enamel or dentine off the tooth to prepare the tooth for the bonding. I know it sounds horrible and you say, wow, why would you put acid on the surface of a tooth? Well, you have a lot of film of different things, including food or different things that have covered the tooth area. So in order for a filling to bond to the tooth, you would have to remove all of that film, and the film only is removed by something strong like acid. And by the way, these are very special type of acid, like a phosphoric acid that they use in dentistry. So it's not just like any type of acid. So be careful if there is something on the surface of your teeth. Don't think, oh, you're just going to get some acid and it's going to remove it and it's going to be okay. The next definition that we like to cover is a very important word, and that's ADA. ADA is American Dental Association. It gives dental health related information to many of the dentists, and basically is the authority that stands for all the dentists, and at the same time it is very informative for the public. The next definition that we like to cover is adhesive. Adhesive is the procedure of applying a substance to the surface of materials that binds them together to avoid separation between the same, and it's called adhesive. Basically, When you're gluing something to something else, that's called adhesion. And that's the process of adhesion. So adhesive pretty much is a fancier word for glue. So you're gluing things together. So in dentistry, when you're bonding things together, you're having a filling, and the filling is composite or something like that, and you're bonding in the tooth, you use adhesive, you use a special type of glue that bonds that together. The next definition that we like to cover is allograft. Allograft involves taking a tissue from a donor and placing it in a recipient during a medical procedure. A dentist may transfer fragments of bone from one person to another, and if the procedure is applicable to a patient's condition, that's what they use it. When we talk about allograft, it's like taking bone from a cadaver and putting that bone. For instance, when you want to put implants, for instance, do you see the bone that's kind of right here? It's gone down and it has receded. When there is a bone recession and you want to put an implant in the space right here, we would put an allograft. We take a bone from a bovine, or we take it from a cadaver and put bone right there, and it would raise this area, so it make it better and more prepared for an implant. And the next definition that we like to work on is alloplastic. What is an alloplastic? Alloplastic refers to a material that is not biological. It is man-made, such as metal, ceramic, plastic. These materials are used medically to make implants or prostheses. This is, for instance, this implant right here. That's a good example of that definition. An alloy, it's the next word that we like to cover. Alloy is a combination of two or more metals that is composed of material of a metal and a non-metal is called an alloy. It may be a single phase or a mixture of metallic phase or intermetallic compound without any boundary between the phases. So, and then the next definition we like to cover is called alveolar. What is the next word that we like to cover is called alveolar. Alveoli is basically the tooth socket. When we have an area of the mouth that basically what you have is the socket where the tooth sits in the tooth right here. That is an alveolar area. And alveolar bone is commonly known as the tooth socket. The alveolar bone is the main support for the tooth, anchoring them to the bone in the upper and lower jaws by a tissue called cementum. So the surface of this tooth is cementum, and this area right here, the socket, is the alveolar process. The next thing is to cover is alveolar bone. Alveolar bone, commonly known as a tooth socket. The alveolar bone is the main support for the tooth, anchoring them to the bone, upper and lower jaw by the tissue called cementum. So the next word actually is connected with the other word is alveolar process. Alveolar process is basically this whole area right here. Alveolar process is the part of the mouth that contains the tooth sockets. It is a thickened bridge of the bone and is also called alveolar ridge. In humans, is alveolar processes are the maxilla and the mandible. So this lower area is called mandible. The upper area is called maxilla. So that's maxilla right here, and that's mandible. And all of the sockets that are there that holds the teeth, those are called alveolar processes. Now, that leads into the next word, alveoloplasty. Whenever in any kind of dental procedures or medical procedures, they talk about plasty. Like when they call plastic surgery, they're not talking about putting some plastic over somebody's face or doing some, they're talking about plasty. Plasty is when you are changing a surface, changing the form of something. So alveoloplasty often refers to as bone trimming. Alveoloplasty is a surgical procedure that which smooths out the sharp areas of the jawbone that commonly occurs after multiple tooth extractions. Like for instance, when we remove this tooth right here, you are going to have these sharp areas of the bone right there. So these sharp areas of the bone, they need to be filed down when they extract the tooth. Otherwise, it will just cause some pain and discomfort. Alveolus is the next word. Alveolus are also called tooth sockets, where the roots of the teeth are located in the jawbone, held in the place by the periodontal ligament. So this is a socket right here, and then this is the tooth, and then there are little tiny fibers of the gum that from gum reaches to the tooth, and it holds the tooth in place. They are kind of very much like shock absorbers. Everybody, who does not know dentistry enough, they think that teeth are fused to the jaw. They are actually part of the jaw, and they're all together like that. It is important for you to know that these teeth are actually moving in the socket, in the alveolar area. If you hold your tooth and move your tooth, any single tooth, you will see that the tooth moves back and forth. If you press it in a little bit, you see actually has some cushioning. That cushioning is because of the alveolar process and then these gum tissues, the small fibers that are holding the tooth in place. The next word is one of my least favorite words in dentistry, amalgam. What is an amalgam? An alloy of different metals, including silver, tin, copper, mercury, which has been used for over 150 years in dentistry to fill cavities in the teeth, commonly referred to as silver fillings because of the color of these fillings. The reason these things are is my least favorite word in dentistry is because when they put these amalgams in the tooth, because 50% of the amalgam is composed of mercury, and mercury has a very high coefficient of expansion and shrinkage. So when you drink something hot, it expands, that amalgam expands. And when you drink something cold, the amalgam shrinks. So the shrinkage and expansion is going to shatter your tooth, is going to break your tooth, is going to cause fracture lines in the tooth and Caries lines. They're called Caries lines, all the small fracture lines. So amalgam, even though they have been using it for 150 years, I do not recommend anybody to use amalgam anymore because of the properties, physical properties, that the shrinkage and expansion. But of course, on top of that, it does not take a genius to understand that mercury is not necessarily the best thing for your health to be in your mouth. So I highly recommend you not having any amalgams placed in your mouth. And if there are any existing ones, of course, they have to be removed carefully. That amalgam, that mercury fumes when they take out, that also could be damaging. So again, that's definitely my least favorite word in dentistry. What is an anatomical crown? Anatomical crown, the natural part of the tooth which is covered in the enamel and is the part that you can see extending above the gum line, is called the anatomical crown. For instance, right here, this part of the tooth that's white, that's the anatomical crown. All of these areas you see, the white area, that's anatomical crown. Now, what is anesthesia? Anesthesia is a medical procedure to control pain during surgery. It is a temporary state consisting of unconsciousness, painlessness, loss of memory, and possible even muscle relaxation. And it is done in many different ways. So, when you do anesthesia, it can be general, it can be local. We're going to talk about the different types later. Now, what is ankylosis? A dental abnormality in which the tooth becomes fused directly to the jawbone, which prevents the tooth from erupting. The cause of ankylosis is unknown and can occur in both baby teeth or permanent teeth. Basically what happens when we talked about the alveolus, the bone, the socket right there, and the tooth having a bit of a cushion that basically the gums, there are gums, gum fibers basically between the tooth and the socket that's holding it as a cushion. That does not exist, and it goes away, and then the tooth is pretty much fused to the bone. There is no medium between the two. That is basically ankylosis, which if you ever have an ankylosed tooth, it makes it more difficult for extraction, so hopefully you never have to get extracted. Or if somebody wants to get root canal done on the ankylosed tooth, most of the time is a bit more difficult. What is an anomaly? Anomaly is usually defined as something that deviates from standard, normal or expected. So anything that's abnormal in dentistry, we call it anomaly. For instance, supernumerary tooth, when you have an extra tooth in your mouth, that's an anomaly. Now, the next terminology that we use in dentistry often, it's anterior. We have anterior, which means the front, which is the opposite of posterior, which means towards the back. So these are anterior teeth right here. These are the anterior teeth, the front teeth. And these are called the posterior teeth. The teeth are in the back. Now, anterior, the term anterior is usually used when referring to the teeth, specifically the incisors, the canines. It refers to the direction of the root tip of the tooth. So, like I said, basically the front teeth are called the anterior teeth. An apex. Apex is the end of the last part of the root in the tooth. It can also be defined as the extremity or terminal portion of the root. So when we are talking about an apex right here, the tip of the root is called apex. Apexification is the process of promoting closure of the root in a treated tooth using calcium hydroxide, paste, or other tissue tolerated material in the root canal after a root canal. So when you would do a root canal treatment on a tooth, this particular tooth actually is a very good example that when you remove the nerve and you clean it out and you actually fill the canal, the sealing the tip of the root right here, that's called apexification. Apicoectomy. Anytime in healthcare they talk about ectomy, it basically means chopping something off. It means excising, taking something out. An apicoectomy is a dental procedure in which a tooth's tip is removed and cavity that has set itself into the root is removed and filled with a safe material. So sometimes you actually perform a root canal on a tooth, and the root canal does not take care of the matter. So what we do in dentistry, we actually go inside the jaw right here. For instance, this is a very good example, this tooth right here. We actually do a surgery from the side of the jawbone, and we go in there and we just cut the tip of the root, remove the tip of the root. And when the tip of the root is removed, then it's filled backward from the bottom part. So basically, a root canal has taken care of the upper part of the tooth going inside the tooth, and then from the lower part, we actually go in there and seal it. So it actually becomes a closed tube, and there is very unlikely any bacteria can get into the tooth at that point. This is the last step that we take in dentistry before opting into extracting a tooth. But of course, nowadays with the science of implants, after a root canal fails, usually people do not go for an apicoectomy because it's a pretty involved procedure. Usually they just remove the tooth and place an implant, and voila, we got much more predictable results. Arch. What is an arch? The dental arch refers to one of the two arrangements of the teeth located in the human jawbone. Each arch is a crescent arrangement of teeth. One in the lower jaw is called mandibular arch, and one in the upper jaw is called the maxillary arch. So basically I have two arches, one arch here and one arch on the lower. Autogenous graft. A bone graft that is from patient himself or herself as opposed to a cadaver, bovine or bone substitute. A bone graft is usually performed for the purpose of building a better foundation for a dental implant. So this type of bone graft is, for instance, you can actually cut a piece of bone from the corner of the jaw, because this is a very dense bone right here, very, very thick bone. You can actually remove a piece of bone from right here and you can implant it somewhere. Let's say this tooth is missing, you can take a bone from there and put it right here, and that is a very viable way of getting a graft. Also, same goes for gums. Whenever you need a gum graft, you can actually take the graft from your palate and put it there, so you don't have to have any foreign grafting. Of course, when you get a cadaver, there's nothing to really worry about, because it's all of the biological substances are sucked out of there, is cleaned, so you don't have to worry about diseases transferred from a cadaver to a live human being. Now we like to discuss what is a bicuspid. A bicuspid is because a tooth that it has a cusp. In dentistry, every one of these sharp areas is called the cusp. So these teeth are called cuspids, the front ones. But bicuspid is like this tooth right here. They are your premolars, and those are called bicuspid. What is a biopsy? In dentistry, a biopsy consists of removing an area of soft tissue inside the mouth in order to help diagnose a lesion that has no obvious cause. So whenever you see there's a tissue is of concern, what we do is we go in that area, we remove that tissue very carefully with a special blade, and we put it in a container and we send it for a laboratory study. So that's what's called a biopsy. A Bitewing Radiograph. When you go to the dentist and they're taking x-rays, and the dentist tell the assistants, oh, take 4 bite wings, they're not talking about butterflies. Here, the Bitewing is a radiograph referred to an image produced utilizing radiograph, generally a standard x-ray specific to the Bitewing view of the mouth. The Bitewing radiograph allows the dentist or technician to examine the bone condition of the crowns of the posterior teeth, the back teeth, and the alveolar bone. So basically, when you take that x-ray, they place an x-ray right behind these back teeth right here. And then the x-ray hits the tooth from right here, from this direction. And when they do that, it's recorded on the x-ray. And of course, nowadays, most of the x-rays are all basically digital x-rays. So it shows what's happening between the teeth. Usually that's why they take Bitewing x-rays, to actually show cavities between the teeth, or what's happening to the bone and the area between the teeth. Bleaching. This is a very interesting word, and it's very important for you to pay attention to that. It's a procedure in dentistry that assists in whitening the teeth. I personally never use the word bleaching. I call it whitening, because once in a while there are people that they think bleaching is they actually use bleach, and they don't understand that this is some kind of a byproduct of hydrogen peroxide or carbamide peroxide. And what they do is they go and get a gallon of bleach and they pour it in a cup and they swish with the bleach and they expectorate, and they think that is going to whiten the teeth. That is very dangerous. It's very harmful. So make sure that when they talk about bleaching, they are not talking about an actual bleach. So pay attention to the word, and it's really better to use the word whitening. Bonding. What is bonding? In dental terms, bonding is most likely the least expensive cosmetic procedure and one of the easiest. Resin is a compound that can be shaped and formed to a tooth that may have a chip, crack, hole, and even gaps. It adheres nicely to the tooth and can be done by most dentists. Some of the old timers, they don't feel comfortable with bonding, but any of the newer generation dentists, they have learned how to do bonding, and it's really a very easy way to restore teeth versus using things such as amalgam, which we talked about already, and amalgam, definitely try to do your best to stay away from it. What is a bridge? A dental bridge refers to the process of creating a bridge over a gap in a tooth, in the teeth, usually from one or more missing teeth. So when you are when this tooth, for instance, right here is missing, and we prep the tooth behind it and prep the tooth in front of it, and then we make, in the laboratory, we make something that goes over the two teeth, and basically it bridges these teeth together. It is a very nice and easy way to fill a gap in the mouth, whether the gap is 1, 2, or 3 teeth, or even sometimes more than that. But with the technology that we have nowadays with implants, as you see on this side of the model, we actually have had a missing tooth right here, and instead of bridging it, we actually placed an implant, and then we put a crown on top of that. And of course, the advantage is that we did not prep the 2 other teeth, and the other 2 teeth are in pretty good shape, and we don't have to compromise the structure of the other teeth. What is bruxism? Bruxism is the excessive grinding of the teeth and excessive clinching of the jaw. It is an oral parafunctional activity. It is unrelated to normal functions such as eating or talking. So you cannot be bruxing when you are eating or talking, but when you clench your teeth together, people who are that unknowingly they are angry about something, or they're stressed about something, and they just clench their teeth, and it usually happens at night more than any other time, because people who have stresses and they have bad habits, or they have malocclusion, which means their teeth don't come together right, at night they grind their teeth together to try, the jaw is trying to find the right position. And of course, in the cases of bruxism, a night guard is indicated. So bruxism is basically another word for grinding teeth. What is buccal? Buccal means relating to the mouth or relating to the cheek. For example, the buccal surface of a tooth is the part of the tooth that touches the cheek, as opposed to the palatal surface of the tooth, which is would be a side of the tooth that touches the tongue. Basically, a tooth has several surfaces. So this top part is called the occlusal part. I better use the larger model for you. Actually, this smaller model is good because it shows the relation of the other teeth. So the top part is the occlusal part, and then the part that is towards the tooth in front of it, towards the front of the mouth, is called the mesial surface, and the surface that's towards the back of the tooth is called the distal surface, and the part that is towards the cheek, towards the outside right here, that's called the buccal or facial, and the part that is inside, that is towards the inside of the mouth right here, that is called the lingual, because it's towards the tongue. It's very simple. So don't let dental terminologies intimidate you when you go to the dentist, and the dentist is calling out, oh, there is an MO on tooth number 2. And you wonder, wow, I wonder what I have on my tooth number 2. Well, it's the tooth right here, and MO, which means basically mesial and occlusal part, which means towards the front of the tooth and towards the top part of the tooth, you're having a cavity. So that's where that term comes. What is calculus? a form of a hardened dental plaque on an individual's tooth, which is also referred to as tartar, that develops over time due to various reasons such as poor oral hygiene or poor diet. So basically, the tartar becomes hardened and it becomes calculus. We're not talking about math calculus, we're actually talking about hardened minerals. And it leads to the next word, which is caries, a form of tooth decay and deterioration of oral health that is due to an infection from a bacterial origin in a person's mouth that causes the demineralization and destruction of hard tissue, in this case, destruction of a tooth. That's called caries. And caries, in other words, is just like we use it interchangeably with cavities. It doesn't mean the same thing. Cavity basically means a hole, and caries is the deterioration of a tooth. Like for instance, in this situation, as you see, when the tooth gets demineralized and the decay goes into the tooth, it starts eating into the enamel, and the acid basically eats out the enamel, and it leads to what is cariogenic. Cariogenic is defined as something that would cause tooth decay. Dentists typically suggest that you avoid cariogenic substances or brush thoroughly after consuming this kind of cariogenic foods, such as foods that contain sugar in them. Anything in biology that says genic is basically comes from genesis. It starts something. So cariogenic, it means it will start decays. It causes decays. The next word, of course, we talked about already, is cavity. Cavity is a decayed section of a tooth. Cavities can typically be filled, however, can require more invasive procedures such as root canals, depending upon the severity of a cavity. So the caries leads into the cavity, and the cavity leads into other problems. So that's why it's very important that every time a decay is a small, very, very tiny decay, take care of it while it's small so it does not get into something larger and it becomes a bigger problem. Goes back to the definition that they say an ounce of prevention is worth a pound of cure. You hear that over and over in dentistry. It's exceptionally important. Now, what is cementum? A thin layer of bone-like substance that covers the root and sometimes other parts of the tooth, also known as cement. This substance is yellow and not as hard as the enamel. So when you look at a tooth right here, this thin layer that is covering the root area, root surface, not the crown. The crown part is enamel, equivalent of what covers the coronal part, the top part of the tooth, equivalent of that down here where the root of the tooth, root surface is called cementum. And as you see inside of a tooth structure, this is a better, nicer, larger model that actually shows right here. This layer is enamel, and then a very thin layer basically covering the tooth is kind of yellowish. That is called cementum. And of course, the layer inside the tooth is the dentine layer. What is a cephalometric image? A computer-generated image used to generate a tooth to fit the mouth exactly the way teeth will fit in a patient mouth before a surgery. So cephalometric x-rays usually basically show the relation. Usually it's like a sagittal. It shows the relation of the upper and lower teeth together. And they typically use these images for orthodontics purposes. When a dentist wants to move the teeth and put them in the right position, those cephalometric x-rays and images are pretty important. What is a cleft lip? A cleft lip is a birth defect found in newborn children. The cleft refers to a gap that develops in the top lip, creating a space that splits the top lip into two visible parts. Basically, people who have cleft lip, they looks like this lip has been cut open right there. And of course, with the surgery and plastic surgery and oral surgery, they can actually make it nicely come together and fix it. And then, of course, the next word leads into what is a cleft palate. Cleft palate is a condition in which the two palates of the skull that form the hard palate, the roof of the mouth, are not completely joined, and that occurs in about 1 in 700 live births worldwide. So basically, as the skeleton develops, as in a fetus, the palate at some point is open and it closes slowly, and it becomes one hard palate. So in 1 in 700 people, that top part does not close, and it keeps the palate open into the nasal area, and that definitely has to have a surgery and close that area. What is clinching? Clinching is the act of pressing teeth together with force. This is typically done out of anger or to suppress some other emotion. People who are stressed, people who are upset, that's when that action of clinching happens. What is a clinical crown? A reproduction of a part of top of a person's tooth that is used to cover a missing area of this particular tooth to prevent further deterioration of the area due to constant use of aging. That is basically the definition. What is the definition of a complete denture? A reproduction of a person's teeth meant to replace the individual's missing teeth so that the individual can eat normally with no problems. This is also done for cosmetic reasons. So basically, people who lose all of their teeth, they get prostheses, which means fake teeth, and they get a denture, which is upper and lower denture. And of course, with technology that we have now, we can definitely put implants and then put the dentures on top of the implant. That way, you have a much better force of chewing and eating. A composite. A composite filling is a tooth-colored plastic and glass mixture used to restore decayed teeth. Composites are also used for cosmetic improvements. There are many uses of composite in the mouth, but those are typically the two uses that we use. Composites, which are basically plastic, one form of plastic. Sometimes they are mixed with glass, sometimes are not mixed with glass. A conscious sedation is a medically controlled state of sedation during which the subject is kept from losing consciousness, so that the airway protective reflexes and the ability to respond to stimulation or verbal commands are preserved. So they basically are not knocking the person out completely. They are understanding the commands, but at the same time, there's enough medications given that really keeps the person very calm and pretty much sedated. Core buildup. When a tooth needs a crown, but there is not enough material to build it, an additional section is made using artificial materials and make it big enough to hold onto the crown. In case there is an exposed nerve, other materials are put first to protect the part. So when you, for instance, right here we have an example of a crown prep. Basically, whenever there is not enough tooth structure, so what we do is we actually add some composite material and build the tooth up with bonding and make it big enough that can actually hold the crown that goes on top of it. That's what the buildup is. Coronal. What the word coronal means. Corona, it comes from crown, like corona. So coronal is in dental terms means in the direction or in relating to the crown of the tooth, as opposite to the root. Coronal polishing would entail brushing and cleaning of the surfaces of the crown of a patient's teeth. So basically anything from towards the top of the tooth right here, that's called coronal, and anything that goes towards the root of the tooth is called apical. What is cosmetic dentistry? The term cosmetic dentistry can be defined as the same way cosmetic surgery as defined. The person has elected to alter the appearance of part of his or her body to resemble the ideal look that is acceptable in society today. In this case is altering the tooth by straightening it or making it look more white or putting it in a different position. So that's cosmetic dentistry. Of course, the correct word for that is aesthetic dentistry, because cosmetic, it's basically you would make it look Hollywood. You would make it look to the what people may think is perfection. But aesthetic, it basically gives you the smile, creates a situation that it would look pleasant with that particular patient. For instance, you cannot give a very, very white teeth to an 80-year-old. When people would look, they know, okay, they're gonna say, wow, you got such nice looking fake teeth. You have to make the shade a little bit darker so at least you look like you have nice, natural, straight teeth. And same goes for somebody very much younger. You don't want to give them darker teeth. So it has to go with the shape of the person, it has shape of the mouth, it has to go with the color of the skin and all that. So there's a lot of different things come in play, and they call that aesthetic. But whenever it's cosmetic, it's basically, as they say, you make it Hollywood. And that Hollywood is not necessarily always the best thing, because then it will look fake. So aesthetic is a better term, and it's more of my favorite term than cosmetic. Cracked tooth syndrome. Cracked tooth syndrome involves tooth that has incompletely cracked, but no part of the tooth has been broken off. The symptoms are different from each other. It is totally depending upon the diagnosed condition. So basically, a tooth is fractured, but it's not fractured all the way. So when you bite down, you still feel the pain, but a person cannot quite put their finger on where the issue is. And that's where a good practitioner, a good dentist comes in play, that they are going to diagnose very carefully and go spot by spot until they find that cracked area, and they can actually address the issue and take care of it. What is a crown? A dental crown is a device used to cap a tooth. It covers the tooth to improve its appearance, strength, and or stability. A crown is cemented on and can be considered semi-permanent. So as we talked about, it's like, for instance, when you are having a tooth that's prepped and a crown goes on top of that and it's cemented on top of that, that's what a crown is. Which leads into the next word. What is crown lengthening? A crown lengthening, a surgical procedure performed by a dentist to expose a greater amount of tooth structure for the purpose of subsequent restoring of the tooth, is called crown lengthening. This process is used to adjust the gum and the bone level to expose more of the tooth so it can be restored. So for instance, if we want to repair a tooth and we do not have enough of the tooth, a good example again would be this tooth right here. If we don't have enough tooth exposed and we are trying to cover the tooth, then we do surgery basically right here when the gums are over the tooth, over the teeth right here. We do surgery and remove some of the tooth, the gums around the tooth, and then At times, we have to also remove some of the bone. This is the inside right here. So if you cauterize some of the tissue, and then you have to also remove some of the bone, so we can have a bigger structure of the tooth that we can work with. Now, what is curettage? A curettage is a tool designed to scrape or scoop soft tissue from the mouth or other body part. In the mouth, it is used to scrape away tissue near teeth to promote the growth of new disease-free tissue. For instance, if you do an extraction, you remove a tooth, if there is infected material inside there, like this yellow part right here is infection, what we do is we do curettage and we remove all of that infection, we scrape it and remove it so the tissue can heal faster and it prevents infection. Definitely it helps the process of healing much faster. And the word cusp, what is a cusp? A point on the grinding surface of a tooth is called a cusp. Like every one of these areas that are raised, like the mountainous area on the tooth right here, these tips, these are called cusps. And a cuspid, that's the word that comes from cusp. A cuspid is a tooth that is usually, it has one of these sharp areas. A cuspid is usually also called a canine tooth. A cuspid is a tooth with a single cusp, a point. Cusp is another name for a human canine tooth. They call them cuspid. These teeth are located between the incisors and the premolar, and they are recognized by their elongated and sharp appearance. Humans have 4 cuspids or canines teeth. In each, there is one in each quadrant. So these 4 teeth right here and right here, these are called the cuspids because they only have one cusp. Now, what is a cyst? A cyst can be the size of a pea, a small lump under the skin. The most likely come due to an infection. It's basically a small cluster of cells that have grouped together to form a small scar or a bubble. Like right here, this is a cyst. This yellow area right here, that's a cyst. And sometimes in an infected area, it creates a cyst that they usually have to be removed. Otherwise, it can lead into bigger problems. Now, what is cytology? Cytology is the study of cellular structure and their makeup chemistry. It helps determine their function, and it's usually taken from tissue or fluid samples from the body. It can help to diagnose a disease such as cancer or other ailments. Debridement. Debridement is the removal of calculus and plaque that has been gathered around your teeth in order to keep your oral health in good condition and avoid tooth decay or tooth disease. So whenever you go to a dentist and they actually use instruments and they go and scrape on the teeth and they really go deep and scrape them and clean them, that process is called debridement. What is decay? Decay is also referred to as a dead tooth structure. So basically, whenever there is a cavity in general terms, or something that basically destroys a part of a tooth, like this black area right here, that's called a decayed area. What is deciduous? Deciduous or deciduous teeth are the teeth that grow during the first phase of teething period in a baby. It usually starts to grow at the age of 6 months to 2.5 years. These teeth total 20 in number and are classified as incisors, canines, and molar teeth. These teeth normally begin falling out at the age of 5 to 6 years of age. Basically, they are your baby teeth. Deciduous dentition. Deciduous teeth are commonly called baby teeth or primary teeth, developing during embryonic stage of development and become visible in the mouth during early childhood. These teeth are usually lost beginning at age 6 approximately, and then are replaced by permanent teeth. A dental implant is a piece of material that is inserted into the existing bone to support an artificial tooth. In this situation right here, as you see, this is like a screw. It actually, in fact, is a screw that is put into the bone, and on top of that, there is an area, it's like an abutment, and then on top of the abutment, there goes the crown. So that is the definition right there. Dental prophylaxis. A dental prophylaxis is performed not only to clean the teeth, but also to evaluate oral cavity for any other problems that may be present. The cleaning not only includes what you can see, but also the area under the gum line, which is most important part. For this reason, non-anesthetic cleaning is not a viable option. Dental prosthesis. A dental prosthesis is an artificial device used to correct dental defects such as missing teeth or missing parts of the teeth. They also can be used to replace missing soft or hard structures of the jaw or palate. Dental specialist. Dental specialist is a chosen profession that focuses on the health and well-being of your teeth. They are experts in determining if a tooth is in need of cleaning or removal of cavities. They also determine if a tooth is salvageable, and if not, help in removal and replacement of such said tooth. So all of these specialties, by the way, you may have orthodontic specialty for straightening teeth. There's specialty for endodontics to do root canals. There are specialties in periodontics, which means they address the issues with the gums. There's pedodontics that are addressing the issues that children have with their teeth. And the next word that we like to define for you is dentine. Dentine is the hard, dense part of the tooth made up of calcium carbonate material that makes up the majority of the tooth. Underneath the enamel is harder and more dense than bone. It is one of the 4 components that make up the tooth. It is the second layer of the tooth. So as we talked about this before, as this is the tooth structure right here, and we have this layer right here is the enamel, which is the hardest hardest thing in your body is enamel. And then there is cementum, which is covering the root. And then the dentine is the second layer or the inside layer of the tooth. What is a dentition? Dentition refers to the arrangement of the teeth in the mouth. How many teeth are present in certain species and how many types of teeth are present. It can also refer to tooth development, often called cutting teeth or teething. So dentition, basically in human beings, we have 32 teeth. Tooth number 1 starts right here, up here, and this is tooth number 16, drops down to tooth number 17 down here, and it's tooth number 32. So whenever you go to the dentist and they talk about your dentition, and they're talking about the numbers of the teeth in your mouth, they're talking basically of tooth number 1, or they talk about tooth number 2. These are actually talking about the teeth in your mouth. So remember, if they're talking about tooth number 1 to 16, it's your upper jaw. If they're talking about number 17 to 32, it's your lower jaw. So it's good for you to know, so when the dentist and the assistants are talking about these things, you feel like, I've heard that before. I know what they're talking about. Denture. Dentures are false teeth, historically made from a variety of materials. They are supported both by their own design and against both hard and soft tissues in the mouth. Dentures are also generally removed daily as only a part of the time replacement of the missing teeth. So it is important, because they are made of usually of plastic materials. It's important to give your mouth a break from dentures, remove them at nights, let the material be out of your mouth so the tissues breathe, the tissues can recoup from all the wear and tear they got from the prostheses, from the dentures. So in the morning you have a fresh set of tissues dealing with the prostheses and then dentures. What is a denture base? A denture base is putting in a sound structure lining gums that allow the denture to fit and hold a good seal, that bacteria and the plaque don't sit on the gums while the dentures are placed in. So basically it's the foundation is underneath those fake teeth that they put. That's a denture base. What is a diagnostic cast? A diagnostic cast is a replica of a patient's teeth that is created using impression. The cast is then used as a diagnostic tool for the dental team. So when you go to a dentist and they actually take your impression, then they take it to a laboratory and they pour stone in it, and then they remove that cast. They take it out of the impression. Now they have your mouth right in front of them. You don't have to be right there for them to look at you. They actually can do a lot of the work on the diagnostic cast and do things with a diagnostic cast. What is a diastema? Diastema is the space between the upper incisors. This occurs when there is an unequal relationship between the size of the teeth and the jaw. So somebody who has a bigger jaw, bigger upper jaw, but they have smaller teeth, then they are going to have a gap between the teeth. So another word for diastema is, is gap. Gap between the two front teeth is called a diastema. Direct pulp cap, a technique used to directly apply protective substance to the exposed pulp of a tooth cavity. It is used to prevent the pulp from decaying and having to perform a root canal. So basically, when a decay is removed in a situation when there is root canal is needed, basically when we have this situation right here, that let's say we have had a decay that has all the way gone into the area and is very close to the nerve. This is the nerve and the blood system of the tooth, inside the tooth. So we put a medication on the closest area at the bottom, and when we put a medication right there, then we put the restoration on top of that, and that way the tooth will fight for itself and will prevent the need for a root canal therapy. So that is a very good procedure, and every dentist should do that before the tooth would be needing a root canal. It's the ethical and the right thing to do whenever there is a deep decay. Distal. This refers to the direction pointing to the last tooth in each dental arch quadrant. A mouth has 4 quadrants. 1, 2, 3, 4. Each 1/4 of a mouth is called a quadrant. And as we discussed before, when we have a tooth right here, the surfaces of a tooth, the one towards the back is called distal, towards the front is called mesial, towards the outside is called facial, and towards the tongue is called lingual. Dry socket. It is possible complication after having a tooth removed. The scab that covers the socket is removed and leaves it exposed to everything, and it can easily be infected afterwards. So when we extract a tooth out of the socket right there, the next thing that happens is blood basically comes in the socket right there, and the normal process of the healing is that the blood is later converted to tissue, and the tissue is converted to bone, and then this becomes hard. So what happens is when the tooth is removed, and if the blood clot comes out of that socket and that socket is exposed, then the bone starts just breathing and that, that air exposure to the bone, it causes that dry socket, as simple as that. So make sure every time you have an extraction, make sure you keep that blood clot in there very carefully and do not suck on a straw or do something that you would lose the blood clot. What is an edentulous? To be edentulous means to be toothless, without teeth, or it's the result of tooth loss. Partial edentulous refers to only being without some teeth, and complete edentulous refers to being completely toothless. So it says, be true to your teeth, so your teeth will not be false to you. Enamel. Enamel is the hard, thin, translucent layer that serves as the protection for the dentine of a tooth on the crown. It is made up of calcium salts. So enamel actually is the hardest thing in your body. This thin layer right there on the top, that white area, that's enamel. So you have to be very careful and very protective of your enamel, because once you lose your enamel, the second layer is dentine, and dentine is not as hard as enamel. Enamel is the hardest substance in your body. Endodontist. What is an endodontist? Endodontist is the specialist who specializes in treating root canals. That's pretty much what an endodontist means. What is an erosion? Dental or acid erosion is the eating away of the enamel and dentine by foods and drinks with a low pH, with acidic pH. Often though to be caused by soda pop or certain fruit juices. So you got to be careful to keep your saliva in an even pH and not make it acidic, because then the acid destroys the teeth and basically eats out the enamel. Exfoliative. Exfoliative describes the thin layer of skin or epidermis shed from the surface of the gum area. So whenever a part of that, our gum tissue is basically top surface is lost, that's exfoliated. An extraction is the proper surgical removing of any particular item. In the framework of dentistry, this would be most often referred to extraction of a tooth, perhaps due to severe damage or severe decay, severe traumatic injury to a tooth, or reduced crowding. Whenever there's crowding and you want to make a space, basically you extract a tooth. Extraoral. Extraoral can mean on the outside of a tooth or cavity, or it can refer to the outside of the mouth. That word extra is always mean the outside. Intra means inside. What is an exudate? When a liquid escapes from the body through the pores or a wound, that's called an exudate. The liquid usually contains many different materials in it, and sometimes contains pus from an infected area of the body. It can also leave a scab on a wound when it dries up. What is a filling? A filling is a type of material that goes into a drilled or cleaned out tooth to restore its ability to be used regularly. Typically, this is used after a root canal due to an opening left in the tooth, or sometimes when a tooth decay or a cavity basically is cleaned out. That's what restoration is. What is a fixed partial denture? Just like the denture we talked about that is for a full area, a partial denture is basically replacing a few teeth. It's not for replacement of all the teeth. So when you make a fixed partial denture, it's basically when you have a denture that has been somehow anchored by adjacent teeth or is been anchored by implants. Fixed prosthesis. A fixed prosthesis is a dental area that focuses on permanent restoration of either single or groups of teeth. This can include crowns, veneers, bridges, inlays, and onlays. Fixed removable prosthesis. Fixed removable prosthesis is a custom set of artificial teeth to replace missing or remove teeth. This fixed removable prosthesis can be removed by the user or to make the cleaning easier. Basically, it's like dentures that they take out, or it's partial dentures that people take out and they clean and put it back in their mouth. What is a frenum? Frenum is a piece of skin that connects the lower lip to the lower jaw, and it's also the tissue that connects the tongue and the lips to the gums. So, like when you pull your lip forward and you see this line right there that is right in the center and is connecting your lip to the tissue, that's a frenum. And then when you raise your tongue up and then you see that tissue that is anchoring your tongue down, that is also called a frenum. And where does it come in play is sometimes people have a speech impediment, and like there was this kid that had speech problem, and they had taken this kid to a speech therapist for years and years, and suddenly went to a very knowledgeable dentist, and the dentist said, wait a minute, the frenum underneath the tongue is so thick that basically anchored the tongue down, and this poor young man could not speak because the tongue was anchored down, and it just literally took 5 seconds for the dentist to use a cauterizing instrument and cauterize that tissue, and it removed that frenum and freed the tongue, and voila, this young man could speak again. I actually could speak for first time. What is a full mouth x-ray? A procedure involving an x-ray machine that is used to access a person's full dental health to make sure that there are no underlying issues that need to be fixed and addressed. What is a forcation? Forcation, bone loss as a result of a tooth disease. It usually occurs at the root trunk of the tooth, where two or more roots come together. So in this situation right here, it's just basically the word speaks for itself. Forcation is like a fork. Like when you eat food and you have the fork that you put in the food, all of these areas, well, they look like a fork. These areas are called forcation area. So whenever the gum recedes down and the tooth is exposed right here, let's say the gums recede down, then this area where the tooth becomes like a fork and it opens up, that area is called the forcation area. What is a general anesthesia? Medicine that is given to the patient as they go under for a specific type of surgery. It usually wears off the same day and is best used to help the patient not to feel the pain or the work is being done. So pretty much is like the patient is completely knocked out and all the work is done, and then the patient becomes conscious. They don't even know what has happened. So this is done for extreme situations. What is a gingiva? Gingiva, they are the gums that help hold your teeth in place and help protect the teeth from any infection or damage from food and everyday interactions with outer world. So basically, gingiva is a fancier word for gums. So when they tell you you have gingivitis, it means your gums are inflamed. It's not a horrible word. It's not a nasty word. It's nothing to be scared of. So basically, when you have gingivitis, it means inflammation. Anything that has itis means inflammation. So gingivitis is the inflammation of gums, inflammation of gingiva. So it's important for you to brush and floss and remove all the plaque so the gingivitis will go away. What is a gingival hyperplasia? Gingival hyperplasia is a condition marked by an overgrowth of gum tissue within the mouth. This is a common condition related to the drug fentanyl, which is used to treat epileptic seizures. So basically, when you have the gums that are around the tooth, and some of these medications, they basically affect the gum and the gums grow really thick, more than usual. That's called gingival hyperplasia. Any type of word hyper means growth. Hyperplasia is like that's overgrowth. Gingivectomy. Gingivectomy is a surgical procedure done on the gums. It is done when someone suffers an extreme case of gingivitis that mostly likely cause to other serious health conditions. A gingivectomy will reshape the gums, remove the gingivitis, and gives your teeth a more natural shape. Also, in the situations of perio problem, gum problems, when there is basically cleaning just does not cure the condition, it is best to use surgical instruments and remove that excess gum, remove that excess growth, so it will give the tooth and the gums a chance to breathe and remove that excess bacteria and those extra pockets. So when you remove those extra pockets, and pockets are not the normal depth, they're excessive depth, that's called gingivectomy. What is gingivitis? Gingivitis is a common type of gum disease. It can result in a gum becoming red, swollen, and irritated. It is caused by lack of proper dental care. It can lead to more serious gum issues and sometimes even loss of teeth. To prevent this, you should brush and floss daily and obtain regular dental checkups. So as we talked about before, any word that has itis means inflammation. Gingivitis means inflammation of gums. Periodontitis, it means when it has progressed further and it has involved the periodontium, which is the deeper tissue of the gums. What is gingivoplasty? Gingivoplasty is a surgical procedure typically performed by a periodontist to reshape the healthy gum tissue surrounding the teeth. Severe cases of gingivitis typically requires this procedure as well. So gingivectomy, sometimes you see somebody smiles and they have a very gummy smile. When they smile, instead of you seeing nice beautiful teeth, you see a whole bunch of gum. That's when the periodontist can do gingivectomy, cut some of the gingiva back so it will show more teeth and less gums. What is a graft? A surgical procedure to move tissue from one side to another of the body, from another person without bringing its own blood supply with it. Sometimes it can be artificially manufactured device as well. What is an HMO? This is one of my least favorite words in dentistry. It's Health Maintenance Organization. An HMO is a type of a dental insurance coverage that accepts financial responsibility for providing dental services to those covered under their policy. This type of, we have a full video on HMO versus PPO, and I encourage you to go and see the video on HMO versus PPO, and you will see why you should choose a PPO rather than an HMO. Never choose an HMO, especially in dentistry. That's very counterproductive. Hemisection. A hemisection, literally dividing in two, is a procedure that involves cutting a tooth with two roots in half. It's typically performed when decay or bone loss begins to occur in a tooth. So basically, when you have a tooth in this area right there, towards the back, and this tooth has more than one root, and then it has cavity and is all bad in one area. So basically, what we do is you cut this one root and the crown, and basically is thrown away, and you save the other half of the tooth. And it's not. It used to be very common when the implants were not that common, but now implants have become very prevalent and very easy to place. So therefore, the process of hemisection is not really done that often. High noble alloys. A mixture of two or more metals containing at least 40%. In addition to it, must contain at least 60% of combination of gold and palladium or platinum, osmium, iridium, and rhodium. So whenever you have these, I would say, precious metals, that's the definition. Immediate denture. An immediate denture is a denture, either complete or partial, that is placed in a patient's mouth immediately following an extraction of the remaining teeth. So in the process where they do actual dentures, the teeth are removed and then they let the bones heal, and after the reformation is done and the bones are healed, they make the actual dentures, they make impressions. But for immediate denture, they actually take the impression, send it to laboratory, they make a prosthesis or fake teeth denture, they come in, and at the same appointment that where they are going to be delivering the denture, at the same appointment extract the teeth. So the patient does not go around without teeth. But of course the disadvantage is that the bones will reform later, so it has to be relined. What is an impacted tooth? An impacted tooth is a tooth that has failed to erupt through the gum and has grown improperly inside the gum or the jaw. This is a serious problem and is usually only correctable by surgery. This right here, as you see, there is a tooth that has not erupted and is impacted, and it causes problem for the adjacent teeth, or it causes future problems for the gums, and possibly it can be detrimental in some cases. What is an implant? This is one of my favorite subjects because implants have been an amazing replacement for a lot of situations where we're missing teeth. An implant is a term used medically to describe a non-human object put inside a person's body to alter their appearance while looking like a natural body part. In the situation of dentistry, these are like implants. They actually are like a screw, and that screw is placed inside the bones and gum, and then they restore the tooth that goes on top of the implant, just like that. It's a very cool procedure. Incisal. We talked about the anatomy of the teeth. The incisal area of a tooth is the cutting edge of the tooth, like just right here. That's called the incisal. Incision and drainage. A dental infection that leads to an oral swelling requires incision and drainage. The act of cutting and releasing infectious fluids, it's called incision and drainage. If left untreated, these infections can travel quickly through the surrounding tissue and could be quite fatal. Incisor. Incisor teeth are these front teeth. They actually are the teeth that are used for cutting or biting through the food. That's why they're called incisors. Indirect pulp cap. An indirect pulp cap is a procedure to prevent an exposed tooth pulp from becoming inflamed due to exposure. It is a type of sedative placed on top of a thin layer of dentine. Like when you have a decay right here, just like this cavity that has been, or in common term we call it cavity, and it's like on top of the nerve, we clean that area and then we put a medication on top of that, and we then restore the tooth with the hopes of the tooth fighting for itself and restoring itself, and it would prevent a root canal. That is an ethical thing to do. We should never jump to conclusion and do a root canal. We should do everything we can to prevent that, and that indirect pulp cap or even direct pulp cap, those are procedures that we do in order to prevent that. An inlay. What is an inlay? An inlay is a filling that is fitted on a tooth with a cavity. The inlay is made by creating a mold of the tooth impression and then cementing it into a place over the tooth. Inlays can be gold, silver, or porcelain. An inlay is a good alternative to composite filling restorations. Basically, the decayed area of a tooth is removed and They take an impression of that, send it to the laboratory, or even sometimes chairside, they can actually make something, and then that is cemented inside the tooth. Those usually last longer than doing a direct composite or a direct filling. An interim prosthesis. An interim prosthesis is any sort of temporary prosthetic. It is not designed for long-term use, and it is generally replaced by, as soon as possible, by a permanent prosthesis. So basically, it's a fake tooth or a fake partial or anything that you're having it, and it's just very temporary. What is interproximal? This term refers to the spaces that are between the teeth. The gum will be between these teeth. The orthodontist can correct this problem. They can do this by making your teeth narrower. And like this is called interproximal, like between the teeth, the space that's in between the teeth, that's called interproximal. When you are flossing, basically you're going interproximally between the teeth. Intracoronal. Intracoronal refers to the interior of the tooth, interior of the crown. Dental amalgams are intracoronal, as are partial dentures that fit inside of a remaining tooth or teeth. Intraoral refers to the inside of the mouth. In dentistry, intraoral cameras are used to show patients images of the inside of their mouth so that they can use these cameras and they can actually see the problem spots that are existing in the mouth. And anytime you use intra means inside, extra means outside. Intravenous sedation or IV sedation. IV sedation puts the patient into a state of sleep, relaxation, and feeling of not being bothered by what is going on. This type of sedation produces either partial or full memory loss from the time that it kicks in until the time that it wears off. It's used quite a bit whenever there are patients who are extremely nervous and they would like to just relax and get the dental work done. Jaw. Skeletal structure that makes up the upper and lower frame of the mouth and containing the teeth. Jaw can also be used to describe the part of the face that covers these structures. Like this is a lower jaw, and then we have the upper jaw on top of that. So that's, as calling it all together, is a jaw. Labial. As we talk about the surfaces of the teeth, as we have described before, labial basically means towards your lips. So the surfaces of the teeth that are towards the outside, right here, this is the labial surface. The one towards the inside is called the lingual surface. And the one towards the top is called the occlusal surface. And towards the front of the mouth is mesial surface. And towards the back of the tooth is distal surface. Like when a dentist says an MOD filling, that means mesio-occlusodistal. MOD in dentistry does not mean manager on duty. It actually means mesio-occlusodistal. What is a laminate veneer? Laminate veneers are super thin layers of porcelain created to look like tooth. They are placed and bonded over the front teeth and serve as the cover up for discolored and damaged teeth. Those veneers, typically they kind of look like nails that somebody puts like a very thin layer of a fake nail, and people look and they think that's an actual real nail. In a way, the same thin material is made of porcelain, and they bond it on top of sometimes on existing teeth, and sometimes they remove a little bit of an enamel and reshape the teeth, and they bond the veneer on top of that. A lesion. Open sore that can look like a laceration, can be as small as a paper cut to an unlimited length. Lesions can be found anywhere throughout the mouth, stomach and intestinal tract. In the mouth, typically the lesions are addressed by placing medicaments, but typically lesions in the mouth, they heal within 14 days all by themselves. If you have a lesion that does not heal within 14 days, you should be concerned. If you have a lesion that has lasted longer than a month or so, you have to see a pathologist right away, because if that lesion is not healing, very likely that is a cancerous area and needs to be evaluated and make sure we eliminate the possibilities of having any malignant or cancerous tissues. Lingual. Lingual is an adjective that refers to the tongue. It can be used with other anatomical terms to describe location. For example, sublingual means under the tongue. So anytime you see the word lingual, it has something to do with the tongue. So again, with the surfaces of the teeth, the part of the tooth that is towards the tongue right here, these surfaces right here, these are the lingual surfaces. These are the facial surfaces. These are the occlusal surfaces. And this is the mesial surface towards the front, and this is the distal surface towards the back. Local anesthesia. Local anesthesia refers to an injection or an application of an anesthetic drug that only affects a specific area of the body instead of the entire body like general anesthesia. We use that a lot in dentistry. Every time we are working in a certain area of the mouth, we actually use a local anesthetic, and we give the injection of typically any kind of a liquid anesthetic that can numb that particular area. That would make it easy for us to work. In the situation like when we have a local anesthetic, the way it works is that you have the blood vessels and then you have the nerve. This yellow thing right here, the yellow string, that's the nerve. So when you give anesthetic like lidocaine or any kind of those derivatives of family, when you give it right in this area, it basically blocks that nerve and it numbs that nerve, so you don't feel that, because as you see, these nerves all go into the teeth. What is periodontal maintenance? It is occasional teeth cleaning to make sure the teeth stay clean and healthy. It is often done 1 to 2 times a year. It is to prevent any tooth damage and possible loss, because when your gums are the foundation of your teeth. If the gums get loose, then the teeth will get loose and you will lose them. Malocclusion. Malocclusion is a misalignment of top and bottom teeth when the mouth is closed. The teeth in opposite arch of each other don't line up, and they are as they're supposed to. Malocclusion can most commonly be seen as an overbite or underbite. As you see right here, it is typically corrected by doing orthodontics, basically putting braces on. So the way the teeth come together, it have to be nicely aligned. It is very similar to like your car. When the tires are aligned, everything is in harmony and you have even wear and tear. Same thing goes in dentistry with the teeth. When you have the right alignment, then you have even wear and tear, and as a result, you will have a long life for your teeth. Mandible. Mandible refers to the jaw or jawbone. It is most commonly used when referring to the lower jawbone in mammals and fish. In this situation, this is actually a mandible right here. The lower area is mandible and that upper part is maxilla. Maxilla. Maxilla is the upper jawbone and it is formed by 2 bones that fuse together during the child's early development. Together, they form the upper palate and the upper jawline. So your upper jaw is called maxilla and the lower jaw is called mandible. Mesial. Mesial refers to the middle line of the body or the surface of the tooth, closer to the center of the arch. So again, as we talked about the surfaces of the teeth, this is the mesial part of this canine, the front part right here. This is the distal part of the canine. This is the facial part. This is the lingual part. And this is the occlusal surface. So a tooth has these 5 surfaces. Any tooth in your mouth has these 5 surfaces: occlusal, facial, lingual towards the tongue, and then mesial towards the front and distal towards the back. Microabrasion. Microabrasion is a technique that utilizes a mixture of hydrochloric acid and pumice, which is rubbed into the surface of the tooth repeatedly until the outer layers of the enamel containing the stains are abraded away. Basically, it's a process that you are using the pumice, mainly the pumice does the main action, and it removes a layer, the outer layer of the stains on the enamel. Molar. Molars are the most posterior teeth in the mammals. Its flat surface helps to grind food during chewing. The name came from Latin word mola, means millstone. So basically it's like milling something. And because of these back teeth right here, they're like that, they're called molars, molar teeth right here. Mouth guard is a plastic guard that put in the mouth to protect the teeth and the gums during assorted sport events, or can be used to protect the teeth at night for people who grind their teeth. The ones that are found in sporting stores, the sporting goods stores, that they are usually good for actually, sports. But for dental use, whenever you're grinding your teeth, they have to be made, custom made by your dentist. Obstructive sleep apnea, a sleep disorder in which a narrowing of the throat or relaxation of the throat muscles cause a short-term blockage of the airway during sleep. This temporarily causes a person to stop breathing. Occlusal, it refers to the contact between the teeth during chewing or during rest. When the mouth is closed, there is always a chance that there could be something wrong with the contact, such as overbite, underbite, which can be corrected. So basically, occlusion is when the upper and lower teeth basically come together. That's called occlusion. The relationship of the upper and the lower teeth together, that is called occlusion. Onlay. An onlay is a fabricated prosthetic made in dental laboratory that fits inside and over a portion of a tooth, looking exactly like a natural tooth when completed. Onlay is used when a filling is going to be too large, causing the potential for fracture. Onlay can also be used if a patient does not want to replace a large filling more often, as onlay is made with more durable material and are bonded to the tooth for a long service life. So in a way, an onlay is like a crown coverage that goes over the tooth that we talked about before, but it does not cover the entire tooth. It only covers the parts of the tooth that is affected with the loss of a part of a tooth or restored. Apicoectomy. An apicoectomy is a dental operation in which an inflamed or improperly developed portion of the gum line is removed from the surface of an unerupted tooth. Like in this situation right here, as you see, when the gums are overgrown in this area and they grow back here and they cover a piece of a tooth right here, and then basically when you bite down and you feel like, gosh, I'm chewing on my gums, that is, you're actually chewing over the operculum, and the operculum is that piece of gum, and apicoectomy is when you remove that extra piece of gum to relieve the pressure and the problem. Oral and maxillofacial surgeon. An oral and maxillofacial surgeon is a medical doctor who performs surgery to correct diseases or injury to the head, neck, mouth, or jaw. This includes both the hard and soft tissue in the mouth. As we talked about, there are several specialties in dentistry. One of them is an oral surgery. The other one is periodontist, which they treat gums. Orthodontists, they straighten teeth and they do braces. Pedodontists, they treat children. Prosthodontists, they make prosthesis or fake teeth for the patient. And of course, general dentist, GP. And we also have endodontists, which means they are the specialists that treat root canals. Orthodontic retainers are custom-made devices, usually made of wire or clear plastic that holds the teeth in position after a surgery or method of realigning the teeth in a proper way. So when your treatment is all done, they have to create those retainers to keep the teeth in a proper way. At the beginning, you use it for during the day and night, and then after a while, you only use it at night to make sure that your teeth do not go back to the mal position or the wrong position that they were before. Orthodontists. Orthodontists are dental specialists. The primary focus for an orthodontist is finding the cause and treating dental displacements and malocclusions, which are improper bites. Orthodontic surgery, a procedure that uses oral implants to restructure tooth placement. Orthotic device. An orthotic device is a device that supports a weak or unsupported joint or muscle, like a knee brace or a splint for a sprained finger. It helps stabilize the weakened joint or muscle to allow to heal or keep it from worsening. In the situation of dentistry, orthotic device is like a retainer that keeps the teeth in the position that they're supposed to be. Osseointegration. Osseointegration is the process in which a dental implant attaches directly into the bone cells and the jawbone so that the implant is held in place more securely. So basically, when an implant is placed, it's going to take a few months for the bone to restructure around the implant and hold on to the implant really good, and actually the implant fuses to the bone, and that's called osseointegration. Overdenture. An overdenture is a partial or complete denture that is removable and sits on over teeth already present. This makes it unnecessary to remove old or decayed teeth, which allows the patient to retain feeling in the teeth and prevents the jawbone from receding. So in the situation of implants, we can pretty much do the same thing. When we place an implant in the situations that they do several implants and then they put a denture on top of an implant, that's an overdenture. But in the situations then when the crowns of the teeth are not good, basically they remove the crowns and they leave the roots and they put some stubs, and that denture goes over those stubs of teeth. That way the bone is not receded, and those overdentures, they can have a better force of biting. Palliative, a general medical term that means relieving pain. It is not a cure-all, but a short-term method of pain relief until proper permanent treatment can be obtained. For instance, if somebody is in pain, the tooth is in pain, and the dentist goes in there and basically removes the bulk of the nerve and puts temporary filling in there, that is a good example of palliative treatment. Panoramic radiograph. A panoramic radiograph is a panoramic scanning dental x-ray of the upper and lower jaw. It shows a two-dimensional view of half circle from ear to ear. Panoramic radiography is a form of tomography. These radiographs show a lot of different things in them. The quality of the bone. It shows if there is any type of tumor or something in the jawbone. It's a great technology that actually, beside having a specific x-ray of an area, it actually shows the whole overall. And at the same time, you can even check the health of the sinuses. You can check the health of the jawbone. It's a pretty good x-ray showing all of those at once. Parotid glands. Parotid glands refer to the largest of the three major salivary glands. These glands are located in front and below the ear and behind the jawbone, right there. In this situation, like in this right here, this glands right, they would be right here. These are called parotid glands. Partial denture. A partial denture is a denture that is used for a patient missing a section of teeth, but unable to get a bridge. It replaces teeth for cosmetic or functional reasons, but it is removable. This is versus a complete denture that replaces all the teeth. This actually replaces a few teeth. Pediatric dentist. A pediatric dentist is a dentist who has specialized skills for providing dental services to young children, especially those under the age of 16. These dentists have a special personality to deal with young patients because they are often the first dentists that a child gets to visit. As we talked about, dentistry has several specialties and pediatrics is one of them. Pedodontist. A pedodontist is a dentist who specializes in dental needs of children. They can provide routine care as well as treatment for cavities or other dental problems in a child. Periapical cyst. A periapical cyst is an inflammatory growth in the mandible that is usually caused by the necrosis of a tooth that has been badly infected and not properly treated. It is usually treated with a root canal. This is the situation right here. As you see, this is diseased, and it happens at the apex or the tip of the root of a tooth. A periapical radiography is an X-ray technology used to provide information about the teeth and underlying bone. It shows the entire root and crown of the tooth, which provides crucial information to aid in dental diagnosis. So basically, you would get an X-ray that actually shows the entire tooth from this section, not just between the teeth. The Bitewing pictures, X-rays would show. In this particular periapical X-rays, it shows the entire tooth, and usually it would show the health or the unhealthy area of the apex or the roots of the teeth. Periodontal abscess. This refers to a collection of pus in the mouth. These are usually infections and occur in living tooth or in the gum tissue as well. So this periodontal abscess, usually it's the infection in the gum area, and it can spread to go down, and it can eventually spread to the tip of the roots as well. Periodontal disease is a term used for a variety of diseases that occur along the periodontal tissue. It is often also referred to as gum disease. A common periodontal disease is gingivitis. So again, when you have the teeth, you have the gum tissue that encapsulates around the teeth. And when oral hygiene is bad and plaque and calculus builds around there, then these gums become very unhealthy. And just like any muscle in your body that you have to exercise it, these muscles, they need to be exercised by brushing and flossing. And when you don't do that, these muscles become flabby and soft, and they start letting go of your teeth, and basically this process of the gums kind of falling apart, and that's periodontal disease. Periodontist offers oral care to those who require more extensive oral treatment or surgery opposed to general checkups and treatments that can be attained by family dentists. And periodontists basically focus on the diseases of the gum or periodontium. That's why they call them periodontists. Periodontitis is a disease of gums. It is characterized by inflammation in the gum tissue and tissue around the teeth. It can cause damage to the gum tissue and weakening of the bones that support teeth. It can cause teeth to loosen. It is largely the result of poor oral hygiene. So again, when you say periodontitis, is periodontium, which is the gums, and periodontitis, it means inflammation of. Periodontium. The term periodontium refers to the various tissues whose responsibility collectively as a group is to support the teeth, namely the gingiva, periodontal ligament, cementum, and alveolar bone. Plaque. Plaque is a nasty buildup on the teeth that is created by bacteria attaching itself to your tooth. Plaque is one of the main causes of cavities, tooth decay, and gum disease. So this type of plaque is not when you get an award and they give you a plaque you put on the wall. This type of plaque is no good, and stay away from it. Pontic. Pontic is an artificial tooth or the part of a partial denture or a dental bridge that fills where the original tooth was. It does not include the filling or the part of the partial denture that holds in place. It is only the actual artificial tooth or the part that substitutes for the missing tooth. In this situation right here, we actually have a very good example of what a pontic is. As you see right here, we have a bridge, and this is called an abutment. This is an abutment, that's an abutment, and this middle part, that actual part that fills this gap, is called a pontic right here. And a good way to remember it is like a pony. It's a tiny little thing. It's not a full-size horse, it's a little pony. It's a pontic right here in the middle. A post is a thick and a metallic shaft that is implanted in a person's tooth during a dental procedure, such as root canal, to ensure the strength and health of a tooth that is treated. In older days, we used posts more often, but because of the bonding technology and how strong the composites are, we are using less and less of posts, unless in extreme situations where there is not much to hold on to for the crown. So they put a post and they put a build-up around it. Posterior. Similar in definition as when used in other anatomical terms, posterior teeth refer to those teeth located in the rear of the mouth, including the molar and premolar teeth. So these are called the posterior teeth in the back, and these are called the anterior teeth. Preferred Provider Organization, or PPO. In regards to the health insurance, a group of doctors that have agreed to provide services at a lower fee schedule. Those who have a PPO type insurance can choose from doctors that are in the group to receive coverage. This is my favorite type of insurance versus HMO, and we do have a full video on PPO versus HMO, and I encourage you to go and watch that video for more information. Space maintainer. A space maintainer is a device that keeps the space between the teeth. When the space closes due to premature loss of a tooth, there are many different varieties. They can be fixed in place or removable. They can be unilateral or bilateral, one side of the mouth or both sides of the mouth. They can also be placed on either mandibular or maxillary, upper or lower arch. A space maintainer can be any combination of any of these things that we talked about. Mandibular, unilateral, removable, those all are different choices and different types of a space maintainer. Splint. Splint is a stiff material to keep an area straight after a broken bone has been set. It can be made of almost any material and usually covers an area that isn't able to be covered by a cast. So in dentistry, whenever we have teeth that are moving, you basically splint the teeth together so they don't move, and it will help the healing process and prevent the loosening of the teeth and prevent any tooth loss. Stomatitis. Any number of oral inflammation or ulcers affecting the membranes of either inside of the mouth or the lips. Can include cold sores, cankers, irritations caused by allergic reactions. Those are all basically of the family of stomatitis. Sublingual glands. Sublingual glands refer to the smallest salivary glands in the mouth. It accounts for less than 5% of the saliva accumulated in the mouth. And when they say sublingual, basically lingua means tongue, so they are under the tongue. Submandibular glands. They are the major salivary glands found beneath the floor of your mouth. While they weigh a mere 15 grams, they actually produce the majority of the saliva produced in your mouth. the superficial lobe composes most of the glands with a smaller deep lobe beneath it. So these, when they say submandibular glands, when you touch underneath your jaw right here, when you touch underneath here basically, you feel these little, small little bulgy things, and that's submandibular gland. Sub means underneath, mandibular means the mandible, submandibular gland. What is supernumerary tooth? Supernumerary teeth are extra teeth beyond what is typical. They are usually found in the mouth, but they can erupt anywhere inside your head. They can be baby teeth or permanent. A person can have one or more supernumerary teeth, and this condition is often hereditary. So sometimes people have an extra wisdom tooth. Sometimes people have an extra front tooth, and those are called supranumerary tooth. TMJ, or temporomandibular joint. This is the joint belonging to the lower jaw. Its name comes from the bones that is made of: the temporal bone in the head and the mandible, which is the lower jaw. So it's temporomandibular joint. Some people say, I got TMJ. Whenever they have TMJ problem or they have pain here, they say, I got TMJ. Everybody has TMJ. It's like saying, I have a knee, you have elbow. So TMJ, everybody has TMJ. But so in this situation, like basically in the positioning is, this is temple right here, and mandibular, and it's like this is right here, and that's the jaw that it flexes right inside the socket like that. And if you touch your ears, right by your ears right there, and you open your mouth, you actually feel that TMJ. What is TMD? Temporomandibular dysfunction. Again, it's different than TMJ. Inflammation and pain due to malfunction of the joint that connects the jaw to the side of the skull. Symptoms include stiff jaw, muscles, clicking in the jaw, and possible locking of the jaw. Again, when you have this, the mandible sits in the socket right there. If there are any issues or problems with the joint, it causes all kinds of those problems. So when you have those issues, it's called TMD, temporomandibular disorder. But whenever you have TMJ, again, everybody has TMJ. That means that TMJ means temporomandibular joint. A tomography. It can refer to a certain type of CT scan that takes images through sections, a slice at a time. It is used to get a better view of certain areas during a scan. What is a torus? This is a bone-like growth that happens along the inside of the jaw, right below lower teeth, close to the front of the mouth, and near the tongue. So when you see this area right here, actually inside the mandible right here, sometimes people have extra bone right there, and this extra bone is called torus. And then it actually, sometimes you do have palatal tori, but that's not common. But mandibular tori, which means lower jaw, extra bone, it is very common actually. Trismus. Trismus is the inability to open one's mouth. It has a variety of causes, some of which are spasms in the jaw, muscles, and usually short jaw muscles, or it could be a symptom of tetanus. And it is sometimes referred to a locked jaw, especially when it is seen as a symptom of tetanus. So when you have trismus, you feel like you cannot open your mouth, or sometimes you open your mouth, you feel like you cannot close. Do not panic. Sometimes those muscles have spasm. All you need is some muscle relaxants. You need to just relax, put some hot, and see if the hot towel would help. If not, put cold. Just take anti-inflammatory medications. So you just have to not panic, and that the trismus usually just resolves by itself. Veneer. A veneer in dentistry is a thin material that is applied to the outside of a tooth. A veneer could be applied for aesthetic purposes, or it could be placed on a tooth that needs additional protection. Basically, what we do is we remove a little bit of the enamel from the exterior surface, the front surface of the tooth, and the veneers are like porcelain that are usually as thin as a nail. And just like fake nail, that people put a fake nail on top of their nail and it looks natural, same goes in dentistry. We basically bond porcelain on top of the natural tooth to make it look more aesthetic. Well, I hope that this session was informative for you and you learned dental terminologies. And I hope next time you go to a dental office and they use something like tooth number 2 MOD, you don't think that for tooth number 2 they have manager on duty. So those dental terminologies are meant for you to become more knowledgeable. So when you go to a dental office, you understand better what they are doing for your oral health, and at the same time, as the dentist and the assistants are having those dental jargon, exchanging those jargon, you also feel like, hey, I know that foreign language right there. And at the same time, knowledge is power. When you have more knowledge, it's more likely you are going to receive a better treatment and be in charge of your healthcare. Don't assume that the dentist is the all-knowing and they know everything. You know, you have one mouth and the dentist has 2,000 mouths, 3,000 mouths. And what I mean by that is you have to be in charge of your own oral health. The most important person in your life is you. Therefore, be in charge of that and make sure that you know whatever the plan is for your mouth, whether they are doing a crown, whether they are doing a filling, whether they're doing a root canal. I hope that I was enough help to you, that now you feel better about dentistry and you also understand that these jargons are not some foreign words and they in fact mean something. Thank you for all your attention and appreciate you following me through these dental terminologies.